with Lloyd, who is the Teapot Trust Participation Officer. Ali's been with us since October on a project called Young Voices. Also, as well as doing that work, Ali is also the co-founder of the Luna project, which is a peer support charity for children with chronic conditions. So thank you, Ali.
Thank you so much, Kat. I will just share my presentation, which you can hopefully all see now. So yeah, as Kat said, I'm Ali, and I joined Teapot Trust in August as Young Voices Participation Officer. And I am really excited to get the opportunity to chat to you all a little bit about the work that we have been doing with Young Voices so far. Feels like it fits in really nicely after Lynn and Patricia's brilliant presentations, because again, it's kind of focusing on that like bigger, wider impact of chronic conditions. So yeah. First of all, I just wanted to talk, wow, zoom through. I just wanted to talk today, like I said, very briefly introducing Young Voices, and then just giving an example of a Young Voices project that's currently in progress, which hopefully will pique your interest a little bit, and hopefully you'll be interested in staying in the loop with that going forward. So Young Voices at the Teapot Trust is a program of participation that was kind of born out of two different but closely related needs. So that first rationale for Young Voices was the idea that this group that we're working with, children with chronic conditions, is a group that have a really, really distinct challenges and needs that we know are often going unmet. So as Lynn and Patricia have talked about so eloquently, difficulties with coping with symptoms and treatment regimes, feeling different from peers, difficulties at school, having to grow up quickly, medical appointments, feeling misunderstood, not really understanding themselves. And it's also a group that often has power taken away from them in terms of, you know, having to do this medical intervention or having to go to this appointment or having to do this, having to do that. So we know that this is a group that, you know, get a lot out of different support. So for example, with the Teapot Trust Art Therapy, you know, that those 8 to 12 sessions, they get so much out of, but you know, they're still going to be continuing to live with the challenges that come with growing up with a chronic condition. So we had that kind of in mind on the one hand. And then the other thing that we had in mind is the idea that we want the Teapot Trust to be the best it can be. And the people who are best placed to judge whether we're doing a good job or not are the children and young people that we do work with, and crucially, those that we don't work with. And so those are the voices that really, really matter in this conversation about, are we doing the job that we set out to do, which is supporting children and families living with long-term health conditions. And so from there, Young Voices was born as something that both allows for that, a space to meet those unmet needs and a space to kind of learn about, you know, are we doing the job that we want to be doing, and are we doing it as well as we possibly can be? So Young Voices is this program of participation for children and young people that has two core aims that are very closely linked to these rationales. So firstly, to create a space for the children and young people's voices to be at the centre of Teapot Trust work. And secondly, to provide opportunities for the children and young people that we work with. So these opportunities are closely linked to our understanding of what those unmet needs are, and trying to cater to, at those different ages and stages, what are the opportunities that can help to meet those unmet needs. In terms of what this actually looks like in the Teapot Trust, children and young people tend to get involved in the Teapot Trust initially getting involved in art therapy. So this might be a group therapy group, such as the one that Megan was talking about earlier today, or that Patricia's just been talking about just now, or it might be that they had a one-to-one sessions, or it might be that they attended some of the open group sessions on the ward, or were seen in school, or whatever. And then when they come to the end of those sessions, they are given the information and the opportunity to become part of the Young Voices network if they would like. And from there, we welcome them to Young Voices and find out a little bit more about them, what's going on in their life just now, what do they enjoy, what do they not enjoy, what do they find a bit tricky. Looking forward, is there anything that they really want to be able to do? So for the olders, this is kind of thinking about, do they want to, is there a job that they really want to do, or a degree that they really want to do that they maybe don't feel like they've got enough experience or skills for? For the youngers, this might be thinking about things like that high school transition being on the horizon. So just really trying to understand what is it that each child that joins Young Voices needs, to be able to really think about, okay, what are the projects and opportunities that we can offer to them? And once they're part of that network, we tell them about opportunities and projects as they're happening, and there's the option to get involved in as much as they would like, but also the opportunity to get involved in as little as they would like, because we know that living with a chronic condition can be incredibly unpredictable, and it could be hard to, you're not necessarily always going to have the capacity to do extra things, no matter how brilliant they might be. So we try to keep it really, really flexible, and have lots of different levels of involvement available. So I just wanted to tell you a little bit more about a specific project that's going on just now. This is one of about 4 Young Voices projects that is currently on the go. And this one is called Growing Up with Chronic Illness, The Big Picture. And this project was really born out of conversations with young people about the idea that, they would so often be seeing healthcare professionals or teachers or whoever, who would see only the stage that they were at just now and only the challenges that they were facing just now, without any kind of understanding of the fact that that child or young person was not only experiencing those current challenges, but had been experiencing all of these different challenges that come before, and that they had all these challenges ahead of them. And so we wanted to kind of do something around being able to document those well-being impacts of growing up with a chronic illness. So the project aims were about, firstly, being able to bring children and young people together in a space where they felt safe and able to connect over their shared experiences. Secondly, like I said, to kind of create that resource that documents those challenges that come and change with growing up with a chronic illness. And thirdly, to create resources that will inform the people that are working with these children and young people, so that they can do a better job of supporting them. I think that Lynn mentioned earlier that, often teachers don't really have an understanding of the challenges that a child with chronic illness might be experiencing. So this project so far, we've had 2 art therapy informed workshops, one online and one in person, to make it as accessible as possible, which were co-facilitated with Macy Lopez, one of the Teapot Trust art therapists. And we took a very blank slate approach. So for the in-person one, that looked like having just big blank bit of paper and opening it up for children and young people to add whatever they wanted. Key experiences, key stages, key challenges, whatever they wanted. And over the course of those 2 workshops, we kind of pulled together these big timelines that documented some of the key experiences that came with growing up with a chronic illness. And I'm really excited to be able to share with you today just a kind of a very brief overview of what is a really kind of detailed timeline. But I'll just give you an overview of some of those key ages and stages, and then a bit of an insight into the what next with that. So the decision was made to start right at the very beginning. So the first kind of age group that was identified was 0 to 5. And the workshop attendees talked about how this being a time where things with their health were just not quite right. And a lot of their earliest memories were of things being a little bit different and not quite right. So one of the shared experiences within the group was the swinging game, where two adults kind of hold the hand of a child and swing them as they're walking. That was something that ended in injury for a lot of the participants in the group. Then in that kind of age 5 to 9 stage, this pattern of things being not quite right continued, and for a lot of folk this was the beginning of maybe like hospital trips and like healthcare interventions, and that this was quite a tricky time because they weren't really able to communicate what this not quite right feeling was, what this experience was, and they were often not even really invited to communicate that because there was a lot of dismissal and disbelief. One attendee shared that at this age she has memories of running away from nurses and not being believed by doctors. So this was a kind of almost, those first experiences with healthcare for a lot of the group were not particularly positive. Coming into that kind of 9 to 11 was a bit of a limbo for participants. It was kind of becoming clearer to the adults in their lives that something really wasn't right, but there were no answers. There was a lot of being told by healthcare professionals to kind of just that we would just wait and see if maybe things would just resolve on their own, or maybe this medication would be the one that would fix everything, but it just wasn't really known, and that experience was exacerbated for a lot of participants with kind of knowing in themselves that something wasn't right, but a lot of that information being kept from them by adults who were trying to like protect them from the situation. At this stage already there was kind of that feeling of being different to peers. One of the really strong images that came out at this time was the idea of by this point, by 9 to 11, that there had been this things not being right for years and years and years, and wishing that the healthcare professionals would look backwards and really just look properly at their experiences and connect up all those puzzle pieces to find the answer. In reflecting on that time, a lot of participants were sharing how one participant shared that this was so many years of fighting back and forth and getting nowhere. So this was a pretty difficult stage. 12 to 13 was a really, really big point that was identified. This was a stage that we talked about a lot. It was a stage at which folks shared that health things continued to get worse, and they struggled to have the words to explain what it was that was going on, partly because, as we've just talked about, that was kind of how things were. Like, those conversations weren't really being had. Already at this age, folk were beginning to feel too old to belong in a pediatric hospital environment, and it was the kindness of individuals like play therapists and art therapists and youth workers who were really trying to make it work for them that made a big difference. The transition to secondary school was a huge part of why this was such a big age. That was a pretty difficult time for a lot of people. And it was kind of identified as a time of having like dug a hole for themselves, in that they didn't want to tell any of their new friends about their health, and so didn't, and kind of look back on this as a point of that hole being begun to be dug, which soon felt like it was too big to get out of. And like I said, really strong sense of feeling different, and feeling that was a really, like, disability was a really obvious difference at that point. This pattern kind of kept going. By 14 to 16, most had received a diagnosis and were now accessing mixed support. Some people, that diagnosis had unlocked access to brilliant teams and brilliant support. For others, that diagnosis had kind of not opened doors. Instead, it had kind of been met with, oh, we now have an answer, but we don't really have have treatment or good options for you. So that diagnosis point was a very mixed experience. Participants talked about this being an era that was really defined by having a biomedical model understanding of themselves and their illness, and kind of being working against their body, which was very difficult. It was also a period of wearing many different masks. They talked about, you know, having to present things in one way to their healthcare team, and then in another way to their family who they didn't want to worry, another way to at school where they didn't want anyone to know they were different. And actually sometimes they were doing such a good job of pretending that nothing was happening at school that they had teachers, you know, kind of questioning why they had educational support plans, etc., which was an incredibly difficult experience. And I think this quote of "someone actually believed me," for that to have come up for someone in this 14 to 16 age bracket as a really huge thing, when this is, you know, in this big picture, this has been going on for so long, is really huge and really telling of the kind of challenges experienced. By 16 to 18, participants started to see a lot of positive change. This started to be an era of positive change, community, friends, realizing that they were not alone. That's not to say it wasn't without its challenges. There was, you know, that transition to adult healthcare, that transition to having more responsibility for themselves and their healthcare, which one participant described as feeling like they were thrown in at the deep end. And also this, you know, adult care came with a lot of challenges. By this 18 to 20 stage, we have participants moving away, which again came with some really big positives of fresh starts, but also some challenges like being inpatient in a new place, where you don't have that family support network around, and also having to try to navigate life by living independently, or at least living differently. And again, 2022, things are still getting easier. Social model of disability is informing a more positive relationship with themselves, but this kind of like cumulative impact of these experiences that we've just seen does have an impact. Participants talked about, you know, even at this stage with these new friendships, still feeling like there is that difference, often not being able to relate to things other friends are talking about, or not being able to, feeling like, one participant described it as feeling like they'd lost a chunk of their childhood when they looked back on the experiences that they had compared to that of their friends, and still trickiness with accessing healthcare. So just quickly, the next step for this project is that we're going to be creating resources for a number of audiences, including New Start Teapot Trust Art Therapists. We are meeting as a group on Tuesday, which is very exciting, to kind of refine what our key messages are for these different audiences and what it is exactly we want this resource to look like. We're also going to be creating some social media resources to reach other young people, to hopefully help them feel less alone. And if you'd like to be kept in the loop about this resource and receive a copy, then please do get in touch. My email is just there, and this will be shared afterwards. And this really fits in with those core aims of Young Voices as a project, because hopefully it will inform the work of the Teapot Trust, where we need to be, when we need to be, what it is we need to be talking about, how we need to be showing up for young people. And it fits in with that aim of providing opportunities, because it has provided a space so far and continues to for connection and reflection, and to be making a difference, which has so far been met with really positive feedback. So yeah, sum up, Young Voices is Teapot Trust's programme of participation, and the Growing Up with Chronic Illness resource is just one example of a project that we're running. Please do get in touch if you want to talk more about it. I feel like I could talk for literally ages because the children and young people involved in the Young Voices projects are absolutely brilliant. And yeah, I hope I've done a bit of justice to their brilliance and their expertise and the their vision for change and their vision for a world that would work infinitely better for children and young people growing up with chronic illness. And I hope that in doing what we can to pass the power for them to be able to create that world and us to all muck in making that world, we can see for those to come that things are going to be a lot better and a lot easier. So yeah, thank you so much for coming along and listening today, and please do get in touch.